Have you ever had a strange feeling in your stomach and thought it was just something you ate? What if that small discomfort was your body trying to warn you about something far more serious? Something silent, something deadly. There is a cancer that's quietly becoming one of the deadliest in the world. It's not the most talked about. It doesn't always show obvious signs, but it kills fast, and most people don't even know it's there until it's too late. This is pancreatic cancer, and it's rising. It has already begun overtaking breast and prostate cancer in fatality rates across many countries. Yet somehow, it still remains in the shadows. It's called the silent killer for a reason. By the time most people notice something's wrong, it has often spread beyond the pancreas, making treatment far more difficult. But here's something hopeful. Research now shows that key symptoms can appear as early as 3 to 6 months before diagnosis, which means, if you know what to look for, you might just catch it in time. Let's explore these hidden signs your body may already be giving you. Imagine eating a small meal, but feeling overly full, bloated, or even nauseous afterward. Maybe it happens more than once. Maybe it becomes normal, but it's not. When the pancreas is affected, it can no longer produce the enzymes needed to properly break down food. This leads to slow digestion, trapped food, gas, and sometimes even vomiting. It can also result in pale, greasy, or foul-smelling stool, which often floats. These changes should never be ignored. Now think about how often you feel tired. Not just after work, but a kind of tiredness that doesn't go away with sleep. A heavy, drained feeling, even after a full night of rest. This type of fatigue is common in cancer patients, especially pancreatic cancer. Your energy gets drained as your body fights a battle inside. You may lose interest in activities, find it hard to climb stairs, or even struggle with emotions like anxiety or low mood. This is not normal tiredness. It's your body waving a red flag. Ever had a fever that came and went without any cold or flu symptoms? Maybe night sweats or chills that made you shiver, then suddenly go away. These random immune responses can happen when the pancreas is inflamed or blocked. The fever might not last long, but it returns over and over. It's easy to dismiss, but it's often a clue your immune system is fighting something deeper. Your blood can also show signs through clots. Pancreatic cancer increases the risk of your blood becoming sticky and thick, which leads to clotting. This might show up as swelling in one leg, pain when walking, or a warm, reddish patch. Sometimes, the clot can travel to the lungs, causing breathlessness or chest pain. These signs are serious and need immediate medical attention. Pay attention to your belly, not just for bloating, but for changes in its shape and firmness. If the bile duct becomes blocked, bile can back up, causing the gallbladder or liver to swell. You might feel a strange lump or fullness under your right rib cage, or just a general heaviness in your upper belly that wasn't there before. Doctors often find this during a routine exam, but your awareness can get you there first. Now, think about burping, gas, that bloated, tight feeling that doesn't go away. You try antacids, you change your diet, but nothing seems to help. When your food isn't digested properly, this bloating sticks around every day, after every meal. It's not just indigestion, it's a sign of enzyme failure, and your pancreas may be struggling. One of the quietest but earliest warning signs lies in your urine. Healthy urine should be light, yellow, and clear. But when the bile duct is compressed by a tumor, bilirubin builds up in your system. This turns your urine dark brown, cola-colored, or even orange. If it stays that way for more than a few days, even when you're well hydrated, it's time to get checked. Each of these symptoms might seem small on its own. A little stomach pain, a weirdly dark pee, feeling tired. But when 2 or more show up together or continue for weeks, your body is clearly saying something's wrong. Pancreatic cancer doesn't wait, but you don't have to either. The earlier you act, the better your chances. Doctors can run scans, blood tests, and imaging that detect abnormalities. It only takes one step to begin. So, share this knowledge with your family, your friends, with anyone who's been saying, "I don't feel like myself lately." You might give them the push they need to investigate, and that decision could save their life. Don't wait for the disease to grow louder. Hear the whispers now, because when it comes to cancer, timing is everything. If this message made you think, please consider subscribing to our channel for more life-saving health tips and awareness content. Your support helps spread vital information to those who need it most. Your body is always speaking to you, sometimes in whispers, sometimes in warnings. Listen closely, act early, and stay aware. A small symptom today could be the reason you get a second chance tomorrow.